Madam President, I think the American people are beginning to react in a negative way to what they perceive to be happening in Washington, D.C. today with regard to the debate about health care, the debate about new energy taxes in the form of a cap-and-trade program. Of course, we know that there are lots of questions about whether or not there was any value in the $1 trillion stimulus bill that passed earlier this year, which was supposed to keep unemployment at below 8%. And now, in many states, it's well into the double digits and continues to go north from there. And so they've seen a lot of government spending, the $1 trillion stimulus. They've seen a takeover of many industries in this country, whether it's auto manufacturing or financial services or insurance companies. They've seen the cap-and-trade bill, which has passed the House of Representatives, which they know there are debates about how much, but they know is going to increase dramatically what they pay for energy in this country. And now this discussion about the government taking over 1/6 of the American economy in the form of health care. And I think what we're starting to see is the American people, as they engage on these issues, are becoming increasingly concerned about the level of government expansion, government intervention in the marketplace, and the amount of new taxation and new borrowing and new spending that's going on in Washington, D.C. at a time when the American people are being asked, and by virtue of the fact that they have to live within a balanced budget, are being required to make hard choices in their daily lives. And so they see this disconnect between what they're experiencing in their daily lives, their family budgets, and what's happening in Washington, D.C., where there continues to be this pattern of new taxes, new spending, and new borrowing. And logic, I think, would dictate, Madam President, that when you are in a recession, you shouldn't raise taxes. The worst thing that you can do in a recession is to raise taxes and actually crush any kind of economic recovery that might occur. Because as we all know, what helps create jobs in this country are small businesses. When small businesses are faced with higher taxes, that means they have less to invest in new equipment, less to invest in hiring new employees. And the other thing that I think logic would dictate is that when you are running trillion-dollar deficits as far as the eye can see, that you shouldn't be piling more debt upon future generations. And everything that seems like that we're talking about these days is an expansion of government in Washington, D.C. at great additional cost to the American people, either in the form of higher taxes or increased borrowing from future generations, neither of which, as I mentioned, is something that I think most Americans would acknowledge we ought to be doing at a time when you've got an economy that's in a recession and trillion-dollar deficits as far as the eye can see. Now, the current health care debate is a good example of something that people have increasing concern, questions, and reservations about, simply because they see the attempt by the federal government to take over 1/6 of the American economy, to essentially nationalize it, whatever you want to call it. But in any event, it's going to mean greater government intervention, greater government involvement, and an expansion of government in Washington, D.C. And so I think they're starting to react in a negative way against that, and I think more and more members of Congress in both the House and the Senate are hearing that, and I think that's why it's becoming increasingly difficult now to move in the quick way in which the Democrat leadership in the House and the Senate wanted to enact some form of health care reform before the August break. I guess the way that I view this issue, Madam President, is that we ought to look at starting over. Clearly what has been proposed and rolled out so far is not working. It's not working in terms of winning the minds of the American people. It's not working in terms here, even in Washington, D.C., of putting together what ought to be a bipartisan solution to probably one of the biggest challenges and crises facing the American people and facing our economy. And yet so far all we've seen is a bill that's being debated, or at least at the committee level in the House of Representatives, perhaps scheduled for the floor, if not this week, as soon as we get back after the August break. We've seen action by the HELP Committee here in the United States Senate on a bill that by CBO's estimate is about $1 trillion in new costs. Somehow it's going to have to be paid for. And it seems like what we ought to be doing maybe is just pushing the reset button and figuring out, okay, how can we do this in a way that actually achieves savings to the American people and to health care costs in this country, as opposed to actually adding new cost by increasing government spending here in Washington, D.C., expanding the size of government and putting the government in the way of, intervening in that relationship, that fundamental relationship between physicians and patients. Now, there are a number of things which are, in my view, wrong with the current plans. The plan that, as I said, passed the Health Committee here in the United States Senate, as well as the one that's currently being considered in the House of Representatives. And the first fundamental test that it flunks is it doesn't do anything to reduce costs. Now, to me, reform ought to be finding efficiencies, streamlining, looking at ways of doing things in a less costly way to achieve savings. We know that that's not the case with the bill that passed the Health Committee here in the Senate, and we know that the House of Representatives and the bill that they're looking at, according to the most recent Congressional Budget Office estimate, also does nothing to find savings or to achieve any sort of savings as a result of all these changes that are being proposed. So it flunks the first fundamental test of reform, and that is it does nothing to reduce cost. Now, secondly, it does cut payments, reimbursements under Medicare to providers, whether it's hospitals and whether it's the cost of pharmaceuticals. All these things in this country that add to the overall cost of health care are obviously going to take a nick in this. But I think the one thing that we wouldn't want to see happen is that the health care that's currently provided under Medicare to Americans' senior citizens somehow be hurt by the fact that they're trying to find money to pay for this whole new expansion of government health care in this country. And so you've got the issue of cuts to reimbursements currently under Medicare, which very likely would impact the delivery of care, the quality of care for America's seniors. The third thing, another big problem with this problem is that it adds new Medicaid costs to our states. The states currently are participants. Medicaid is a shared program between the federal government and state governments, and there's talk about a significant expansion in the size of the Medicaid program, which obviously costs the federal taxpayers a lot more money, but it also passes on an incredible new and costly mandate to state governments. And many states are figuring that out and are starting to react to it. My state of South Dakota is a good case in point. Our state legislature, governor, people who have looked at this have concluded that it would cost South Dakota an additional $45 million a year in Medicaid costs, which may not sound like a lot of money here in Washington, D.C., but in a state like South Dakota, where there's a requirement that we balance our budget every year, that is a lot. That represents a lot of money. And so obviously that's going to have to be paid for somehow. Now, you get to the larger states, those numbers increase in multiples, and you're talking about new taxes on states in addition to the new taxes that are being talked about here in Washington, D.C. to pay for all of this. So you've got new federal, new state taxes, again, at a time when already many state governments and budgets are strapped and are trying to figure out how to balance their budgets currently. Now, another reason why the current plan is such a big problem and why we need to go back and start over and hit this reset button is because you're going to have a lot of people who are going to lose their employer-provided insurance. Most of the studies have concluded, and the House bill is a good example that I mentioned earlier, that about 83 million people would lose their private health insurance under the bill that's under consideration in the House of Representatives. Now, there are other studies that have been done. This was, I think, a Congressional Budget Office estimate. There are other studies that have been done that suggest that the number of people who could lose their insurance on some of these plans that are under consideration here in Congress could be in the 120 million range. Now, if you consider that we have 177 million people today who get their insurance through their employer, that is a significant number of people who are going to lose their privately provided health insurance and be pushed into a government plan. And that brings me to the next point of why this is the current health care plans being debated here are the wrong direction in which to head and create so many problems. And that is you're going to have more and more people go into the government-run plan, literally millions and millions and millions of people. The people that I just referred to who are going to lose their insurance in the private marketplace are going to be pushed into a government-run plan. And obviously, there are a lot of people who would like to see that. Don't happen to be one of them. I think we ought to preserve what's best about the market and the competition that we have and to allow people to have more choices. I don't think we want to, by default, just start shoving more and more people into a government-run plan when there are opportunities out there available to them today where they can get their health care coverage and their insurance in the private marketplace. That, to me, seems to be a much better model. It's worked very well in some respects for a long time. Now, that isn't to say that there aren't things that we can't do better. And I don't know of any senator on either side of the aisle who doesn't acknowledge that there are things that we need to do to reform health care in this country, to get costs under control, to provide access to more people. But certainly, taking away private coverage and pushing people into a government-run plan is not a reform of the health care system that makes sense to me, or I would argue to most Americans, especially when it's going to cost them trillions of dollars to do that. As I said before, I think most people look at reform as something that would actually reduce or somehow eliminate costs, somehow create greater efficiencies and savings in the healthcare system in this country. And so you've got a lot of people who would lose private insurance and millions of Americans who would be pushed into a government-run program. And again, as I said before, another big problem with this whole idea is that for employers during a recession, it imposes new taxes and new fines, both of which would be very, very costly, and both of which would deprive them of the opportunity, as the economy hopefully starts to recover, to hire new people, to create new jobs, which is what small businesses do best. They are the economic engine in this country. And what we're talking about doing here is imposing new taxes and new fines on them at great cost. And so that takes away a lot of the resources as they generate revenue that they could be able to devote or allocate toward capital investment or toward hiring more people. They're going to be paying fines and taxes to the federal government to underwrite this new expansion of government in Washington, D.C. And I think, again, logic would dictate and history would suggest that the worst thing that you can do in the middle of an economic recession is to raise taxes on the job creators in the economy. And so raising taxes on small businesses is a really bad idea. And in fact, the House bill that is under consideration in the House of Representatives, with the surcharges and the increased taxes, would actually increase marginal income tax rates from a top rate today of about 35% to about 47%. I mean, think about that. The size of the increase in marginal income tax rates that would occur in state and federal marginal tax rates under the plan that's under consideration in the House of Representatives, and how that would impact the economy. That would be the largest tax increase that we have seen since the end of World War II. And frankly, if you think about most Americans and most small businesses, when you start paying a half or 50 cents of every dollar in taxes, you're getting to a point where it's going to be very, very difficult for these businesses to say, why should I continue to try and create jobs, to provide health coverage, health insurance for my employees when the government takes more and more and more of the profits that I make in this business. And I think that's the risk that we run with the job creators, the small businesses in this country who are the economic engine and create as many as 2/3 to 3/4 of all the jobs in our economy in a recession. When you put new taxes and new fines on them, you are just layering and burdening them with more and more costs that is going to make it very, very difficult for them to lead us out of this recession and to start to expand the economy and create jobs. So it just intuitively makes no sense for us to head in this direction. And then finally, I think the last problem with this, and as I said, there are many with the current health care proposals, is you'll have to start dealing with the lines and the rationing that so often occurs when you see a system like what they have in Europe or the Canadian system. And some here actually believe that's the best way to do this, believe in a single-payer system, believe we ought to nationalize our health care system in this country. But inevitably what you will end up with is people ending up in lines. You'll have the government making decisions about which procedures are going to be covered, what the reimbursement's going to be for this procedure or that procedure. It is a disaster and a train wreck in the making. And it's a direction I don't think we ought to go. And so these are all issues that I think point to the need for us to start over, for us to hit that reset button and to sit down and actually figure out what can we agree upon that would be a bipartisan solution to the challenge of increasing costs and a lack of access for millions and millions and millions of Americans. Now, that being said, we have a large number of proposals that are out there which I would submit we ought to be able to debate, and it certainly ought to, as the Help Committee and the Finance Committee, as they go through their deliberations, I think there are many things that have bipartisan support in the Congress for which we could get big majorities and which would address the fundamental issues of access to health care and cost of health care, but none of which are being considered because right now the only plan that's out there is the one that's been written by the Democrat leadership, which consists of this government plan or this government takeover of the health care system. And so we believe that the principles in this debate ought to continue to maintain that people ought to be able to keep their health care. It ought to be health care that they can afford. It ought to provide choices, and it ought to be patient-centered.